Let's discuss useful sentence for OET speaking. 1. Sore joints. I am so sorry to hear that you have sore joints. It is a common problem, but I'm glad to say that there are ways you can reduce your joint pain and discomfort. Can I suggest some ways that might help with your joint pain? Firstly, you can use a hot or cold pack alternatively on the affected area of your body. This can be very effective in helping to reduce the pain. You can also do light stretching exercises, which works well in treating sore joints. These exercises help the muscles around the joints to relax and to retain their strength. You can also buy some over-the-counter pain-relieving creams, which can help reduce the pain. You would need to take some painkillers, which also acts as an anti-inflammatory. Do you think you will be able to try these therapies I have talked about? I think they will help you quite a lot. There are many home services that can help you in your transition to home life. For example, Meals on Wheels can provide nutritious meals every day, so you will not need to cook all your meals. The home care nurses will come and provide you nursing care needs, including help with medications, dressing your wound, and with showering. We can also arrange a social worker to help with any other difficulties you may encounter.